In this special episode, we pay tribute to the brave men and women who serve as first responders in our communities. Join us as we salute the resilience and dedication of first responders and explore how organizations like Aware Recovery Care can better serve those who selflessly serve others. This is the Well Aware Podcast.
All right. Hello, everyone, and welcome back to a very special episode of the Well Aware Podcast. I'm your host, Brian Holzer, CEO of Aware Recovery Care, and I am really excited for today's conversation. Today, we're going to shift our focus and honor the courageous individuals who serve as first responders in our community. And I can't think of two better representatives of both Aware and the first responders community to join me today in this important conversation. Steve Wilcox has been with Aware Recovery Care in Rhode Island for 3 or so years, and Keith Abare has similarly been with Aware for 3 years and change in the Boston agency. Both are first responders and very valuable members of the Aware team, and certainly for today's conversation, even especially more valuable because we get to talk about not just Aware Recovery Care, but their experiences as first responders and how that experience applies to their day-to-day jobs here at Aware Recovery Care. Steve serves as a certified recovery advocate in the Rhode Island area and treats individuals directly in their home, and Keith has a very important role in the community, working to bring awareness to Aware Recovery Care and bring new clients into our program. Today, we're going to delve into the unique challenges faced by first responders when it comes to addiction and mental health and explore how organizations like ours can better support those selfless individuals on their journey to recovery. So with that, Keith and Steve, welcome to the podcast.
Thank you.
Thank you.
Great. I am so thrilled to have you both here. Why don't we just start with your backgrounds? Steve, this is the first chance we've had to interact. Keith, you and I have had some time to spend together over the last couple of months. I can speak from my experience talking to Keith, just an amazing background and such an important advocate for first responders here at Aware. Why don't we start with your backgrounds, both as first responders and maybe leading up to your decision to join Aware Recovery Care. Steve, why don't you kick us off?
Okay, thank you. I started my career in corrections. I spent about 5 years as a Connecticut correction officer. And in the middle of that is when I began my sobriety journey. And once I had my sobriety well intact, I looked around and realized this job was not for me. I have a ton of respect for my fellows who work behind the wall, but it just was not a good fit for me. So I left corrections and I jumped into an EMT course to get up and earning an income rather quickly while I went back to school and really liked EMS. So I transferred from pre-nursing to paramedicine and just fell in love with it. I'm coming up on this month. It's 24 years in EMS.
Wow.
And I heard about Aware through Sarah Doyle, a friend of mine. And the more I really liked this treatment model, it mirrored my own sobriety journey. I didn't do a 12-step or a program. I worked individually with a licensed alcohol and drug counselor who really tailored my treatment to me, which is what I really love about this program.
That's amazing. And Keith, I think you bring a bit of a different background, but in the same vein, also a first responder and also 3 years here to Aware. Why don't you discuss your background and introduce that to our listeners?
Sure. Thanks, Brian. So I started my journey as a 911 dispatcher in the city of Fitchburg in Massachusetts. I did that for 5 years. Then I went on to the Mass Department of Corrections for 22. So retiring almost 4 years ago. Now, where I got into the recovery journey was part of my job with the Mass Department of Corrections is my last 5 years, I was on the internal employee assistance unit. So helping staff go through whatever they're going through, whether it's substance use, divorce, financial issues. So I did that for 5 years. And the addiction part of it, helping folks on their journey to recovery was something that I really enjoyed. So, it was my job to find resources. And that's how I first became aware of Aware Recovery Care was at a conference. They weren't open in Massachusetts yet, but upon my retirement, they were. And I saw a job opening, I applied for it, and here I am 3.5 years later.
What's been your experience here, both of you, in terms of treating first responders now that you're on the other side of the fence? Have we done a good job attracting first responders to our program, or do we have more work to do? And Keith, why don't you start?
Well, I think we always have more work to do, right, Brian? There's always ways to improve. I think for first responders specifically, the in-home is so important. That's a huge barrier for first responders. They don't like that brick and mortar type buildings. They're afraid they're going to see somebody, right? First responders are people you call for help. So that stigma of somebody being in treatment is very difficult. It's a huge barrier for them. So I think just having that in-home model, just the model we provide is super important. But yeah, we have some work to do, especially targeting that population and breaking down those barriers.
You said something really, really important, Keith, and that is first responders are viewed as people you call for help, which I can imagine makes it really hard for someone in the first responders community to raise their hand and say, I need help. Steve, you come to us from a background in the EMS side of the equation, where probably isn't a better example of folks that are calling and needing help, urgent help at that. Can you expand on what Keith said and how we sort of go about addressing the stigma and the barrier for a first responder getting comfortable with raising their hand and say, I need help, and how Aware Recovery Care can help in that regard as well?
I think first responders need to address stigma within their own ranks. I've been doing that through EMS. The last half of my EMS career, I've been very involved in the grassroots mental health, peer support type stuff. And we're getting better. But like he said, there's still the first responder community still has work to do. The last time I talked to a group of firefighters, everybody was really quick to jump in and help a buddy. Okay, but who'd make that phone call themselves? And it was crickets in the room.
Wow.
I do like, and I've heard from my first responder clients, that our treatment model is great because they don't have to go somewhere for 30 days. They don't have to go somewhere for 45 days. They can get treatment without anybody knowing what's going on, and unless they want to tell them. Some first responders are really open about it. I've got one first responder client who will tell anybody who will listen what he's going through and how the program's helping him. I've got others who we've been meeting for coffee and somebody comes up to show him, who's this? This is my buddy Steve. Hi, how you doing? So it varies. They're all very individual, but at the same time, as a culture, they all kind of worry about that stigma and what work's going to think.
And Keith, you started going down this track, and maybe you could expand on it. What about the Aware program has resonated with first responders that we've been able to engage into our program and help on their successful journey to sobriety?
Well, I think the ability, right? We meet clients where they're at. So, and for first responders, that can be, they have a very difficult schedule. Sometimes there's a lot of forced overtime. So we have the ability to work around that barrier. A lot of times when I meet a first responder, I'm the only person who works in my house. I work overtime on Mondays and Fridays, and little by slow, I can take those barriers, those excuses, right? And say, oh, well, if you can only meet on Fridays at 4 p.m., we can do that. I'm like, oh, really? You can? If you have to meet on Sunday at noontime, we can do that for you. So little by slow, I remove those barriers, and then they're a little more interested. And it's removing those barriers for first responders. And again, that stigma of I need help, and taking those barriers and removing them for them. That's where we do a really, really good job. And if they choose, anonymity, right? Nobody has to know they're in treatment, like Steve was saying. In that brick and mortar, in a treatment center, people know who you are. When you're at home, nobody will know.
Yeah, that's so helpful. I mean, Steve, I guess this is an obvious question, but let me ask it anyway. How much does it help you engage the first responder community that you are a first responder? Is it interesting and sort of stops there, or are they more likely to truly listen to the potential recovery avenue, given the fact that it's coming from someone that was in their shoes previously to joining Aware?
It definitely helps that initial connection. And even from my initial reaching for help, I went through 3 clinicians till I found one that could handle what I was bringing to the table. And like, I've had first responder clients tell me, like, hey, your partner's great. I'm getting a lot from your partner, but I can tell you everything. Like there's definitely like there's a cultural competency piece to this whole thing. If I have to stop my client every 2 minutes, well, what's that? What do you mean by that? What do you mean by that? It stops the flow, it stops the conversation. Whereas if I have a level of understanding of their world and what that looks like, it definitely aids in engagement. I've always had my first responder clients have always said like they like my partners, my non-first responder partners. Like I get a lot from them, but it's like I don't have to hide anything from you.
That makes sense. And thank you for that. Keith, why don't you spend a minute and talk about the recent training we did in the Massachusetts agency that you spearheaded, the CISM, which stands for Critical Incident Stress Management. We're now certified as an agency, and I would love for you to explain to our listeners the extent that we've gone to get ourselves trained and ready to be able to engage effectively the first responder community moving forward.
Absolutely, I'd love to. And thank you for that, Brian. It was something that was very important to me, and this is why. So the Critical Incident Stress Management training was put on by an organization called the ICISF, International Critical Incident Stress Foundation. Why that's important is because the ICISF is nationally recognized for what they do. They are the standard of care. So ICIS is the standard of care for treating first responders, which is why it's so important for us. We just talked about, Steve just talked about how, it's easier to talk to a former first responder. So part of my outreach job was, okay, if I can't get former first responders on our team, what's the next best thing? And I came up with two things. One was the spouses of first responders, which we have a few working for us now in our direct care, which I thought was really important. Like, who better to tell their story? Who better to understand what's going on with a first responder other than the spouse? And the second is this training, right? In the first responder community, if you approach, say, a department or a union head saying, okay, how can you treat my folks? And you say, our direct care staff are CISM trained, they will all know what that means. They will all understand that acronym. They'll be like, oh, wow, really? Because it means something in the industry. That standard of care is very important in building the trust to be able to take care of those folks.
You've both said it now at least once, the cultural competency. At Aware Recovery Care, we work very hard on cultural competency across many different cultures to become competent. At the end of the day, we are entering the home. And because you're entering the home, you're getting the full picture of that individual, their family, and their surroundings and environment. And we can't do that unless we are competent in the language and the culture of the person that we're entering, trying to help. It's obvious, I think, that the CISM training is going to help us get better at engaging the first responder community. Maybe irrespective of Aware, could you both touch upon what you'd like to see from the addiction treatment landscape more on a broader level so that the entire segment can get better at engaging and welcoming first responders into addiction treatment? What can the industry do better? I would love for you to touch upon that. Steve, why don't you go first?
I think the best thing they can do, just what you said, what we're working on is the cultural competency part.
Yeah.
There was some great cultural competency wrapped into the CISM training. It was an incredible experience. The conversations I had with some of the people in the class as it was going on were fantastic on breaks. The struggles I've had, even outside of my recovery, even reaching out through, like, at the time, my company's EAP for help with stuff on the job, the lack of culturally competent clinicians is a significant barrier. That's reason that a lot of us have trouble asking for help. We're worried about who's going to answer that call. Are they going to be able to understand me?
That, again, very helpful. Keith, is there anything you want to add to that?
Yeah, well, I think as an industry, right, we treat folks in their substance use, right? Yeah. But as an industry, I think understanding the why behind that, right? Why those first responders are self-medicating, the trauma. And Steve went through this during the training, right? They talk about your trauma, your first, your worst, and your last as a first responder. It could be all one and the same, right? It could be just one bad incident. or it could be cumulative trauma, right? And really understanding the why behind the substance use. And that's usually what first responders trauma. You know, when Steve was talking about meeting with his clients, I was laughing because I can promise you, Steve knows if he goes, say he met a client out in the community, he's not going to walk into a coffee shop and take that client and sit in the middle of the room, right? He's going to grab a table, right? Steve's shaking his head. I'm laughing because Steve knows this, right? And Brian, you might say, why, right? That first responder wants to be in the back of the building, probably next to an emergency exit with their back up against the wall, watching what's going on. And cultural competency, knowing that that's important to them, right? And that would make that they could not be treated sitting in the middle of a restaurant or a coffee shop. They just couldn't focus on anything else but what's behind them, what's going on, what am I not seeing? So again, that cultural competency and then the trauma that associated with the job, whether it's fire services, corrections, police departments, and really understanding the trauma without wanting to hear the war stories. Those folks already have the war stories in their head. That's why they're self. We don't need to hear the war story, but understanding what could be going on in the background and then helping them, deal with that.
And again, maybe another obvious question, but you brought up a very important topic upon, in this case, workplace trauma, a very different type of workplace trauma for first responders than we see with some of our other clients. How important is the fact that the Aware Recovery Care program will address underlying serious mental illness, and how prevalent will that be in helping to resolve the addiction for first responders?
I'll grab that one, Steve, and you can jump in anytime you want. I think, again, understanding that as an organization and then, doing the best we can with our internal folks, getting them, say, up to speed on dealing with first responder trauma. And then when they say, geez, this is a lot, reaching out to folks like myself and Steve, who have a network on the outside of therapeutic providers that specialize in that first responder trauma. So, yeah, our folks do a really, really good job helping with trauma, but just saying this might be too much for what we do right now and utilizing myself or Steve to reach out to our network.
Yep. Steve, anything you want to add and have the last word here before we wrap up?
Just what Keith said, like it's in my opinion, without addressing the underlying cause, it's almost negligent. It's like you're ripping away their coping mechanism and leaving them in what they were self-medicating. You got to have like he said, our internal people are great, but they're also good about. I've had internal people reach out, hey, I'm getting out of my depth. Where can I send this person?
Yep.
That kind of collaboration and just everything's like just client driven. What does this person need to get well?
All right, Keith and Steve, this has been so incredibly helpful. While we wrap up, let me just sort of open it up. And if there's any last comments from either of you, I would love to give you a chance to share those. I've learned a lot from this, and I know our listeners have. Keith, Steve, anything you want to leave our listeners with today?
Yeah, I'd like to touch on something real quick, Brian. We talked about earlier, as an organization, what we can do better to help treat that population. And I think as I'm sitting here, one of it is to get involved in education. And what do I mean by that? Educating departments, chiefs, leaders of those departments. One of the biggest barriers around first responder treatment is administration betrayal. They feel as though if they ask for help, they'll be penalized for it. So getting those department heads, union heads in a room, maybe with a coffee with a cop or a lunch and learn, and explaining to them, like, if your folks get treatment for substance use and mental health, as an organization, you'll lower sick time, which in turn will be lowered overtime pay. You'll have people better engaged in your department's mission. There'll be less civilian complaints and lawsuits, and really getting those folks to understand it's okay to ask for help. It's only going to make your organization grow and become stronger. So I just think that's important for us to get involved in the education part of it with people who make the calls as to what's going on in their departments.
That's a great way to end, Keith. And I think we'll sort of wrap up as we started. This is a group of individuals that spend their lives serving the rest of us and make their day responding to the needs of others. And here, this has been a great conversation about how we can respond to the needs that they have personally And how do we at Aware Recovery Care do a better job of welcoming first responders to make it easier for them to raise their hand and ask for help? Thank you both for your insightful comments and everything you both do for Aware Recovery Care, both in direct client care, Steve and Keith, everything you're doing to raise awareness of our program to the communities that you're in the Boston area. And to our listeners, thank you very much for joining us on this journey of honoring and supporting our first responders. Remember, if you or someone that you know is a first responder in need of support, they are not alone, and you're not alone. Help is available, and we're here to work alongside you to get those individuals the help they need. We have a website with a chat function. We have a phone number that makes it easy for individuals to call and get support from Aware Recovery Care. And for our listeners, if you found today's conversations meaningful, don't forget to subscribe to a Well-Aware podcast. This is the 6th podcast that I've done. We also have our Chief Medical Officer, Dr. Lauren Grauert, who's also launching her own series on the clinical side of our program. And these are all very important discussions as we help to address the serious mental illness and substance use disorder that's facing the communities we serve here in the 11 states that we operate the Aware model. So until next time, take care, and thank you for tuning in.